In this video, I'm going to discuss mirror therapy and some applications that you can use with dysfunction and problems with the hand. Now, in the past, I've bought really expensive mirrors to use for this. This is a pretty inexpensive mirror. I'll put a link in the description, that you can use this at home, or if you're a clinician, you can buy this for your clinic. Again, really inexpensive. It doesn't have to be fancy. If we were trying to do mirror therapy for the entire arm or the entire leg, obviously we're going to have a bigger mirror, but for our purposes for this video, for the hand, this one works really well, and it kind of can fold down, fold it over, etc. And so it does really well. If the patient's having a painful hand or any other extremity issue, but they're having pain or apprehension of movement, what you're going to do is you're going to put we're going to say it's my right hand is my painful hand or my affected hand. Maybe I've had surgery, maybe I have complex regional pain syndrome, some of these different conditions, and there's pain in my hand, nerve pain. And so I'm going to put my hand behind the mirror here, so you see it under here. This is my unaffected hand. So we're just going to start at first without using any of the weights or anything, just movement. So what I'm going to do is I can see my left hand in the mirror. So when I bring my left hand back, it looks like my right hand is moving as well. I can obviously see my left hand, but when I look at the mirror, my right hand looks like it's moving, and it's not moving at all. So initially, if someone's having kinesiophobia, so fear of movement because of pain or whatever, I'm going to go through this, and I would just start, and I would just have the patient just watch the hand move up and down, and just kind of imagine that their right hand or their affected hand is moving as well. And then I'm going to start working on actually moving both hands at the same time. If you'll see my right hand and wrist does not come up as far as my left side does. And initially it would kind of look like that. I'd have the patient just focus on watching the mirror and the movement that's going on. And then eventually, both hands are moving at the same amount. And I'm going into wrist extension, but this could be, opening and closing the hand. This could be working on pinch, grip strengthening. You can take these grip strengthening tools here from Alpha Grips. I like these, but you can use any kind. And I'm going to put this in here. I got one in each hand, and so I'm just squeezing like this, working on strengthening both hands. Now, the right hand might not be able to squeeze as hard. That's okay. I'm going to really focus on trying to keep everything matched up, and I'm watching it the whole time in the mirror to see what looks like my right hand doing the work when maybe the left hand is actually the one that's doing most of the work. You can even do this with dumbbells. So we're going to say wrist flexion. So maybe this wrist flexes all the way up and this one barely moves. So it would look something like this initially and just barely moving. And then eventually both wrists are coming all the way up. And again, I'm watching this the whole time. I'm watching this movement in the mirror while I'm going through this. And I've even used this also for kind of some cortical mapping type stuff, right? Or desensitization. I have the affected hand behind the mirror, the other hand out here, and I'm going to do massage techniques. So maybe I do soft tissue scraping, or maybe I use like a desensitization brush, sensory brushes, there's different levels of those. Now I would do that on the outside of this arm, and then I'd go to this arm on the inside here. I've done them both at the same time, just all sorts of things to try to, kind of calm down the nervous system. And again, the goal is to try to move without having that fear of pain. Another great application with this that you can use, I've used this with NMES or muscle stem. Put this on, the electrodes on there, whether that's a portable box or one of the bigger clinic units. We have both at my clinic, and so we put that on and then have that, the hands going through movements or exercises, whatever, with the electric stem on. I'd put it maybe in the exact same places on both sides just to try to give that symmetrical input. Again, this has been a really powerful tool using the mirror, a really powerful tool with the patients, and they really like it because it's an easy way to give them control, especially on a really painful hand, foot, arm, leg, whatever, to give them some control of the therapy session. They can kind of guide that, where it's not you're physically sitting there stretching their wrist or their hand or their fingers or whatever. It's giving them some of that control, which takes some of that fear of the movement away, and it really makes for a more productive session with your strengthening your range of motion, etc. So again, that's mirror therapy. Give it a try, and thanks so much for watching.